Executive Director, has a lot more information and she joins us on the program. Nice to see you. Welcome to Morning Live.
Thank you so much, Leanne.
So we talk about more services that the clinic offers. What else does this clinic do?
Okay, this clinic is not just a clinic for HIV-infected patients. It's a clinic also for TB patients. So what we've done, in line with the HIV-TB collaboration, with TB being the #1 killer of HIV-infected patients in the country, we've combined the TB and the HIV clinic. We've also allowed the HIV-infected patients to be able to get medication for their other chronic illnesses, so they don't have to queue twice at 2 service centers. So the hypertensive, the diabetics on HIV treatment get their medication from Themba Lethu.
That's amazing. And also one of the, I think, most impressive factors is that usually TB patients would have to wait weeks to find out their results. But the process has been sped up dramatically now.
We've implemented new technologies, and this is what Right2Care is about, in terms of improving the speed of diagnosis of TB. In the past, you needed to take a sputum sample that would go to a lab, and in about 3 days you'd get the first result, but you needed to wait 6 weeks before you got a culture result. Currently, with the system that we're using, it's a lab test that takes about 2 hours, and at the end of that 2 hours, we not only know that you've got TB, but whether the TB is resistant or not to the common drugs that we use to treat.
That's great. And I mean, that just makes a patient's life so much easier, because the waiting is what I suppose is the most detrimental factor. Medication as well. Now, we did see a bit in the insert about the medication, how it's dispensed, and how this process has also been sped up. But talk to us more about the technology involved in this and how you have managed to implement this here and in other clinics around the country.
Okay, I think this was the first clinic in the country, the first public health clinic to have the automated pharmacy machine inserted. But the benefits that we've seen, as you say, are the immense reductions in patient waiting times. In the past, patients who were purely coming to the pharmacy just to collect medication and didn't need to see a doctor would wait about 4 hours. But currently, with the automated system, the machine is doing the picking, the errors are down to 0. Patients are waiting from a minimum of about 18 minutes, maximum about 40 minutes, and they are out of the clinic.
That's unbelievable. I mean, you wish that could be implemented in the main clinic, because I mean, it's the waiting that's the worst. I mean, I saw the queues already beginning now, and the clinic opens at 6:30. I know that we were chatting, and they were saying that the taxis, they pretty much all arrive at the same time, and then the patients come in, so the queue gets longer and longer. How many patients are we processing? About 400 a day?
At present, it's in the region of about 450 per day, but we do have our good days, especially when there have been taxis or transport strikes, and we can see up to 750 or 800 patients a day.
Wow. 800 patients a day, and all successfully seen with their medication leaving.
With medication, I think with the implementation of the pharmacy system as well, we've been able to do stock management more remotely and more accurately, such that we haven't had stock outs in this clinic in the past year, even though there have been 4 major drug shortages throughout the country. This clinic has never had to turn a patient away without medication.
Thank you for talking to us. It's good to know what's going on here at the Thembi Xulu clinic here, part of Helen Joseph. Let me take my hair away. Dr. Thembi Xulu, who is the Right2Care Executive Director, who is talking to us about this clinic and some of the services that it has on offer. We're going to talk more about it because, as we say, it's not only about HIV treatment. There's a lot more that this clinic does do. So stay with us here on Morning Live as we talk about HIV and AIDS and healthcare here in South Africa. Remember, it's World AIDS Day on Sunday. So this is a time to reflect on the country and see what is being done to try and help this dramatic situation.